Pain relief. There are two broad approaches to pain relief. The first is curing the underlying conditions, and the second is palliative care, meaning to treat the pain itself. A third, less usual approach is to allow the pain but prevent it from creating psychological trauma. We'll get to that in due time. It is normal to expect cures for curable conditions, and it is a normal expectation that most conditions are curable. These two facts have enormous ramifications for the US healthcare system. Our system of care is substantially at odds with our expectations, demonstrably due to profit motives and treatment focus. For example, there's a thriving debate about the usefulness and effectiveness of bypass surgery and angioplasty. These procedures do not appear to extend the lives of patients, but do make a great deal of money for hospitals. Medicine does not have cures for a great many sorts of illness, from mere annoyances like colds to life threatening and life altering infections such as HIV. Additionally, the preventive measures for such infections tend to be behavioral rather than medical. In the case of colds, frequent hand washing, proper disposal of infected tissues, sneezing or coughing into the crook of one's arm rather than into one's hand, or worse, the general space around oneself. In the case of HIV, careful partner selection, blood testing, use of condoms. Screening blood donations is the major medical intervention possible in this case. Prior to this practice, many people were infected with HIV during routine operations. For example, Isaac Asimov during a coronary bypass operation. HIV is a good example of an illness for which there is treatment but no cure. Treatments prevent the worst of the symptoms from taking hold and can even reverse some symptoms, prolonging both life and quality of life. The disease remains effectively fatal. While a lot has been done to improve treatment, the possibility of a cure still seems ephemeral. For psychiatric conditions, treatment is more the norm than is cure. The biologic bases of mental illness are not well understood. Indeed, they are hotly debated and may be little more than a medical myth. For example, the idea that depression is caused by some serotonin deficiency is not supported by much more than clinical trials of drugs that improve the movement of serotonin through the brain. Those studies are themselves extremely dubious at this point in time, motivated as they are by the large amounts of profit made by psychotropic medications, medicines that alter behavior or otherwise affect the mind. This industry is the single most profitable market for drug companies, substantially because users of psychotropic medicine are typically not cured of their purported ailments. Rather, they are lifelong customers of drug treatment. And often, once the patient is prescribed one drug, new drugs follow to either aid the effectiveness of the first or to treat the side effects of another medicine. All this profit leads to substantial corruption, inflated drug trial results, ghostwriting, so that corporate advertisements pose as peer-reviewed journals, undermining the journals themselves, and every other way you could think of to buy science. All of which is not to say medicine is without value. Certainly we can help with the pain of a dislocated joint by reseating the joint. This, of course, is not a pain-free process in itself, but the pain becomes short rather than long-term. Mobility is restored and life goes on typically as normal. Rotten teeth can be removed under the same sorts of circumstances. A little extra pain now for less pain in the future. Painful conditions such as cancer can often be both treated and cured using combinations of drugs and surgeries. Bacterial infections are usually curable, while viral ones must usually run their course. And then there are conditions which are neither treatable nor curable. This category includes many of the conditions related to aging, such as arthritis. This condition is not reversible and tends to be quite painful. Other examples might include end-of-life care, when an individual is not expected to be able to recover from their illness, when they have declined treatment for that illness, or when the treatment might tend to be more painful and traumatizing than a dignified death from the illness itself. Certain kinds of life saving treatments, for example, cardiopulmonary respiration or CPR, are very traumatic for the recipients. Patients, especially those who are elderly, can expect a great deal of bruising and tissue damage at a minimum, and frequently broken bones in the rib cage. A patient of advanced age and poor health might wish to opt out of such life saving measures, or if they are not in a condition to decide, their families might decide for them. My father, just 47, opted out of treatment for his cancer, although the cancer seemed to be eminently treatable. 10 years prior, he had lost his prostate gland and part of his bladder to cancer. Thereafter, he lost his wife to it in his mind. He decided to not go through another such experience, to be lessened or cut away any further, but instead to die as he was, with the integrity he had left. Meaning here his already compromised body integrity. Here we have death as a release from pain. This is not by any means a typical reaction to disability. Surviving experiences like spinal surgery, trauma, amputations, and so on can inform us about how tough we are, how capable we are, what we really can do. They can also reduce the importance we place on things like physical competence or beauty, refocusing us on what is real and important in life. We can imagine suicide as a solution to an unsolvable problem, pain that is both inescapable and intolerable. The insolvability of the problem is often only in the mind of the suffering person. The pain turns out to be more temporary than the person imagines, or the person might also learn to tolerate the pain given time. Things are rarely so hopeless as they seem. Cancer can be very painful. It is sometimes possible to cure the cancer with drugs or surgery, resulting in the eventual release from pain. And sometimes the hopelessness the person feels is actually quite real. Their case is considered terminal, incurable, and treatment switches from a cure orientation to a palliation orientation. This means to treat the pain with no efforts towards a cure. This approach might be encountered in hospice care, for example. It's also possible to treat pain on the one hand and the underlying condition on the other. Since the Civil War era, it is unlikely you would have surgery with no anesthesia. While you rest your leg in a cast, you likely have pills for the pain. The dentist numbs your mouth before proceeding with treatment, and then you get drugs while recovering. Treatment for pain can take a number of forms. Topical medicines numb an area of skin by interfering with nociceptors below the surface. Pills work either at the level of the nerves in the body or the nerves in the brain. Narcotics increase the person's tolerance for pain by exploiting our natural pain control system. Injections might use any of these methods. A difficulty with narcotics is their strong tendency to be habit forming. Nor are anesthetics without risk. Even when used properly and responsibly, there is a small chance of error or bad reactions. Patients sometimes report paralysis by consciousness, enduring all the pain of a procedure while unable to react. Modern monitoring methods are designed to detect such consciousness, and these reports are vanishingly rare these days. It is also possible, but unlikely, for anesthesia to be the cause of death during a medical procedure, especially affecting young or old patients. Sometimes the pain people experience in their lives drives them to seek pain relief. Abuse of alcohol, prescription drugs, street drugs, and even anesthesia are not unheard of. It's difficult to imagine the suffering Michael Jackson must have experienced in order to turn to general anesthesia as a sleep aid. This decision ultimately proved fatal. If nothing else, though, his death was a painless one. Chemistry is not the only way to reduce or eliminate pain. It turns out that pain has a substantial psychological component. Hypnotism is only one of a suite of methods for the psychological control of pain. Some people who are sufficiently hypnotizable that they can undergo surgical procedures like tooth extraction without anesthesia. Hypnotism takes advantage of human creativity and suggestibility. The consciousness is able to divide such that the pain arrives at the brain, but is not really acknowledged by consciousness. It is possible to achieve similar results, if not quite so dramatic, through distraction. Engaging in comedy or play can make pain seem less serious. Focus on a task of intense interest can also make pain seem irrelevant. Paradoxically, however, pain itself can make it more difficult to get into your comedy show or your game, or harder still to start the task that can engage your mind. Boredom and sadness make pain feel worse. Not only are both the mind and brain more aware of the pain itself might be more intense as boredom and sadness amplify pain in the brain. This can be a circular reaction. The medical condition leading to pain can make one bored by limiting mobility or activity, and pain is depressing in itself. The more bored and depressed you are, the more pain you feel. The more pain you feel, the more bored and depressed you are. Interrupting this cycle might be the single best thing we can do for someone in pain. Hospitals can be especially bad at this. Patients might lie in bed all day, every day, with limited visiting hours, isolation, and only a television to occupy them. Interestingly, the mind's control over the experience of pain leads to the well-known placebo effect. Just the act of treating pain can result in a decrease in the experience of pain. People who take aspirin report a decrease in pain levels long before it is possible for the compounds in the tablets to have reached the bloodstream. People also report greater effect from medicine when they trust the brand they are taking. Thus, the name brand painkiller really does work better than the store brand, even though they might contain the same compounds in identical doses. Really, anything at all will work for pain relief, provided the patient believes it will work. Treatments such as acupuncture involve a trifecta of factors: relaxation, belief, and relationship. Relationship is the primary factor in how well psychotherapy works and seems to account for how well pain treatments work, even better than the medicines or treatments used. A pill given to you by a doctor you trust probably works better than a pill given by a stranger. Acupuncture, then, can work very well for pain relief, provided the patient gets along well with the acupuncturist. Placebo and social effects can sometimes be weird. Show up at a keg party with non-alcoholic beer. So long as nobody knows there's no alcohol in the beer, people drinking it will begin to act tipsy and disinhibited, just as if they were drinking real beer. Ask people to pretend to be hypnotized and see them behave exactly like people who are really hypnotized. For that matter, watch any comedic hypnotism show. People act out the role of hypnotized subject for the delight of the crowd. So, psychology has a heavy influence on the way we experience pain. Relationships can matter more than compounds. Mood and distraction can make the intolerable tolerable. Pain can be prevented, cured, or kept from consciousness. It can be overcome, leading to greater self-worth and happiness, or pain can lead to self-destructive behavior, from drug abuse to suicide or treatment refusal. The next chapter examines how and why we devalue physical pain, overcome it, transcend it, learn from it, and even use it in ritualistic fashion for self-improvement.